So meaning the entire spectrum, not just the physical symptoms, but also the psychological symptoms can,
Yes,
they can be covered under this kind of things.
yes.
Okay. Commonly of late, like in the past years of your practice, what kind of change have you seen in the kind of symptoms or the diseases the children have been presenting?
Okay, so I think in the past, after the COVID specifically, or in this past 3 years, I think majority of the children are falling sick very often with frequent coughs. Cold and cough are always a part of child's symptomatology ever since. But I think post COVID, because in the COVID time, when the kids were born in COVID and they were not exposed to outside, they were completely homebound. And then once they were exposed to outside world, they tend to fall sick very often. So recurrent cold coughs, allergic cold cough, cough due to this pollution dust which is going on right now in Mumbai and Thane. So this cold cough has worsened a lot. And second, teenage mental health has gone for a toss completely. I don't know, maybe because it was COVID and you were homebound for long, exposure to screen and not allowed activities outside, that has gone very high. And yes, last very close to my heart is that behavioral disorders in kids have been increasing. I mean, ADHD, or you say, if you know of, like, behavioral disorders are many type of disorders. So there is this OD, CD, oppositional defiant disorder, conduct disorder, which in normal term we say anger issues, temper tantrums, and all this have become very high. Also because I feel the parents have become very there is a lot of parenting pressure on the parents, and then every parent wants to do the best for their kid, which is genuinely good, but then overdoing also, and then making them too much safeguard has led to a lot of behavioral disorders in children. I can say that almost 5 out of 10 children nowadays are absolutely like hyperactive, restless, not mannered well, and then they have anger issues, they hit, and all that is going on. So in those cases also, if things are beyond a boundary where the child is harming the other kid, or the child is completely out of hand, you can consider homeopathy to treat this kind of disorders. It is very, very useful.
Okay, now this was about the psychological aspects
Hmm.
of the child's health. Anything in particular which has changed, or you have seen that, let's say fever used to present like this in the
Hmm.
past?
Hmm.
Because at least personally, I have seen that parents panic a lot
Yes,
often
yes.
nowadays because of fever.
Hmm.
So is that panic valid, or like how would you
I
orient
think
that?
that panic is because in this last 5 years, we all have been through that COVID and that panic of not getting fever, cold, cough. So that is inbuilt in all of us. So if a child has fever for more than 2 days, the parents immediately say, blood test kara le, investigate kara le. Where it is any viral fever will stay for 5 days and the kid will be normal from the 6th day. I tell to all my parents. So I tell them you have to wait for 5 days. But yes, we observe the kid. The kid has to be well hydrated. He is not deteriorating. He might be dull, not very active. And also the frequency of fever will reduce over the hours. Like the first day, if the fever was very high and it was every 6 hours, second day it will go to 8 hours, third day maybe every 10, 11 hours, then we know the child is improving. But the parents are very impatient. With the 1 and 2 days of fever, they want to either investigate or go to allopathy and give antiviral fever. I have so many kids who have already like come to me later stage for frequent fevers, given antiviral medicine so frequently, like once in every 3 4 months for like 2 years of age. So I feel that that panic in parents is more higher now post COVID. Previously, like 15 years back, when the parents used to come, they were very patient with me. I mean, they would literally wait till the fifth day and then ask me. So I always say we have a 5 day window period in which till 3 days, if I feel the child is not progressing as I wish to, they are always in touch with me every single day with the temperature recordings and everything, and as and when needed coming to the clinic. So like by 3 days, if I feel that the improvement is not that great, even after changing medicines, I investigate. But any viral fever will stay for 5 days, so we have to have patience. So along with homeopathy medicines, we give them a little soft liquid diet, we give tappet sponging, that all measures have to be taken. But I think parents do have become panicky, so it becomes a little challenging at that time to convince the patient.